My name is Michael Battelle, and I am the president and founder of the Fatty Liver Alliance. We raise awareness about the risk, causes, and complications of fatty liver disease and help those already diagnosed with MASLD and MASH by advocating for access to approved treatments and care. Today, in part six of our 10-part series, we're diving into an important topic, exploring the roles of different healthcare providers and engaging family and friends in the patient journey. To help us really understand this part of the patient journey, I'm honored to introduce my very good friend, Dr. Manel Abdelmalek, who is a hepatologist and professor of medicine at the Mayo Clinic in Rochester, Minnesota, and she is a world-respected expert on MASLD and MASH. So, Dr. Abdelmalek, having a support system can make a huge difference in managing MASLD and MASH. What are your thoughts about the benefits of support in a system for patients for MASLD and MASH?
Well, Michael, thank you so much for this opportunity to join you today. I just always love getting together with you and talking to our patients. They are so very, very important and really at the center of everything we do. So thank you for having me. But to answer the question about a support system, when patients come and see me and I talk to them, it's really important that I understand their journey. We all start our journey in different places from a healthcare standpoint. Many patients may have first seen their primary care doctor and have been noted to have elevated liver enzymes, or maybe you saw your endocrinologist and were told that you had diabetes, and by the way, your liver enzymes are a little elevated. And so patients come through this journey of having liver disease from different avenues and different approaches. And if I can share with you here, it's really important for everybody to understand that just because you have MASLD or MASH, metabolic dysfunction associated steatotic liver disease, it's still kind of rolling off my tongue.
You did well.
Uh, but people, everybody comes to this in their own unique way. Here, I'll share a slide with you and let's see if I can make this happen. Um, you see my slides here?
Not full screen yet.
Not full screen yet. Okay, here. You see that?
Yes.
Okay. So, everybody is different. I'm different. You're different, Michael. I mean, and certainly there are some patients, some of you may have obesity or diabetes, but others of you may really be bound to a desk job and not have the time in a day to be as physically active. Others may have, diabetes or polycystic ovarian syndrome, some endocrine disorders that contribute to the development. Others may have high blood pressure. I think many of us can identify with high blood pressure or high cholesterol, or maybe type 2 diabetes. But the uniqueness of you as a patient is that you may not be quite like the other guy or the other gal that has, metabolic dysfunction associated steatotic liver disease. Their risk factors may be uniquely different than your risk factors. So some patients come to attention because they were at their primary care doctor and the doctor said, hey, yeah, we need to work on diet and exercise and losing some weight. Your liver looks a little fatty, or your liver enzymes are elevated. But others can come to attention because they were at their endocrinologist and their blood sugar is elevated and we're working on diabetes. So all this can happen through different pathways and different journeys that our patients take before they come and see somebody like myself in a liver clinic. And because of these very unique aspects of having a fatty liver, it's important to recognize that because our patients come through different paths and different journeys, depending on where you started off, you may have started off in your diabetes clinic, or you may have started off with your primary care doctor, or you may have started off just because you had a routine health check and your liver enzymes were accidentally noted to be elevated. But wherever you started off, whether it's with your community doctor or your diabetes specialist or maybe your cardiologist was evaluating your cholesterol or your high blood pressure and looking at your cardiovascular risk and incidentally noted that your liver was fatty or your liver enzymes were elevated. Um, or maybe you started off because you had abdominal pain and were found to have gallstones. And by the way, on that abdominal ultrasound they performed to evaluate your gallstones, they noticed that your liver looked a little fatty, but you were under the care of a surgeon. So many people's journeys are different, but ultimately we have to recognize that this is a systemic and metabolic condition, and it really takes a community of providers to care for our patients holistically. So a patient is at the center of this journey and may, over the journey that they have with their health, have contact with not only their primary care doctor, but an endocrinologist or diabetes specialist, potentially an obesity medicine specialist, a nutritionist, certainly a pharmacist or a dietitian, potentially even a cardiologist or a hepatologist, such as myself, if they have more clinically significant liver disease with scarring or fibrosis. Sometimes patients need to be seen by a surgeon because they need routine care for gallstones or what is thought to be gallbladder disease, or potentially are considering other interventions such as weight loss surgery or bariatric surgery for their metabolic care. So the patient certainly is at the center of this team of physicians to care for them holistically, but also another aspect of support and care that I always emphasize to my patients is that support that comes from our families, our friends, our coworkers, because they are the ones who are around us when we need to choose the right foods to eat, choose what we drink, decide to go out to that gym and get some exercise in. And so the element of support and guidance and care that is necessary comes both from the medical community and also our personal family and friend community. So we can't overlook that, Michael. That's just so very important. But this journey from unhealthy behaviors to ultimately a transformation of behavioral interventions that gets us to adapt healthy lifestyles, to exercise, to diet, to make the right food choices, to improve metabolic syndrome is so important for for our patients and everybody on and listening to this webinar should understand and hopefully can implement. But it does take an army and it does take a village of individuals to lend that guidance.
I have heard it said that the specialist that you see is likely due to the door you enter the hospital from. So if you're called through Emerge because you had some kind of heart issue, you're probably going to start with a cardiologist, right? And so that was one piece of it. So I totally agree with you that it's going to be a tailored journey for everybody. And I don't think you can even say two people are going to be exactly alike because genetically we're different, environmentally we're different, and everybody has different challenges, right?
Right. And I think it's important um for for your listeners to understand that when they go see that cardiologist or they go see that diabetes physician or that obesity medicine specialist, that they need to think themselves holistically as well and ask, what is my blood sugar? What is my cholesterol? Doctor, what are my liver enzymes? And maybe that might open up that door for even our providers not to be so tunnel visioned in evaluating us and step back and say, you're right, you have metabolic syndrome. And let's look at all the metabolic stressors that your body may be experiencing because what you may be going through, it might be different than the other patient that walks in the door through that same specialist might be going through. And a tailored approach is really important, but first remembering to ask is
Hmm.
at least opens up a dialogue. Oh, your liver does look a little fatty. Oh, I saw that on the ultrasound. You're right. Let's check your liver enzymes. And even if they've gotten past that point and they now recognize that there's the presence of fatty liver or elevated liver enzymes, then the next question I hope all my patients will ask is, well, how bad do you think it is? Because that really puts us into a different scope of what we call risk stratification and evaluating whether somebody has clinically significant liver disease or not.
Yeah, what you said is really important because I was thinking, I mean, in a perfect world, you'd have all the specialists around you, just like your diagram, and the patient would be sitting there going, so to the cardiologist say, here's what you need to do. And then the hepatologist say, here's what you need, but that's not going to happen. So to put it back on the patient a little bit when they are seeing a specialists to say that, like you said, to try to eliminate those pillars. I think that's a really important point. From all the meetings that we attend around the world too, it does seem like one of the benefits, if you will, of having metabolic disorder is that if you take care of one of those metabolic disorders, sometimes it makes just a little bit of a difference in the liver. And then you take care of another metabolic disorder and, oh, you improved it a little bit more. And then you lose the 5% weight loss and your A1C is better. You're not diabetic anymore. And so I think it's a cascade of benefits that can work together, right?
There's no doubt that the little things that we do, the standard of care things that we do to care for metabolic dysfunction may have downstream benefits on the liver, whether it be the diet or the exercise or controlling that blood sugar or getting the cholesterol in better control with a statin, improving blood pressure, and stopping smoking, decreasing the alcohol use, all these little tweaks that we do can, in the totality of what we do, have a very positive health benefit, not only to our overall survival, but our liver related survival, and ultimately the impact on the steatotic or fatty liver disease itself.
Yeah, you also mentioned too, because of this multidisciplinary these challenges that a lot of the diseases are two-way too. So if they affect the liver can affect them as well. And so, what you said is important that they may see a different specialist who may not even think about the liver disease. And anyone watching this, if they're seeing another specialist, or someone in their family seeing another specialist, that let's say a cardiology issue that they're having, it may have started at the liver, and they should get the liver checked as well, right?
Right. And I think, knowledge is power. When patients go to any provider and know the right questions to ask, it's very empowering because that really allows that provider to help you better, really, because they may be thinking more strategically, they may tailor their care more uniquely. I personally love it when a patient comes to see me and they say, well, doc, could my children have this? Well, that's early intervention for me, right? We eat at the same dinner table. Could could they be at risk because they share the same genes or they share the same environment? And that at least opens the gateway for me to say, I'd be happy to see them. Let's check their liver enzymes or do a quick fiber
Yeah,
scan.
yeah, that's
So
smart.
it's amazing what will happen when you know what to ask, and the communication that can stem from that conversation.
And of course, like you said, that with families, it's also the environmental, so cultural things, foods that they often have historically eaten, as an example, might be one of those contributors too, just to look at. But thank you so much, as always. Very, very enlightening. It's going to be really important for patients seeing this to know it's okay if you're seeing other specialists. We'll get to the liver and make a difference in everything that you're doing. And anyway, but thank you for today for sure. I really appreciate it.
Absolutely, Michael. Thank you for having me.
Okay, let me Stop
Bye.
that.